Hello, welcome to my channel Brand Black 2 TV. In today's video we are going to look at the causes of cavities and the risk factors associated with cavities. I remember in the previous video we looked at the dental health terms, the tooth structure, and all surrounding signs and symptoms of tooth decay. So in today's video we are going to look at the causes of cavities and the risk factors associated. Okay, let us to begin with. For all those that are viewing, endeavor to subscribe, like, share, comment. Brand Black 2 TV. Going straight to the causes of cavities. Remember, we said cavities are holes that are found within your teeth. So cavities are caused by tooth decay. So let us look at the first cause, is what we call the plaque forms. Dental plaque is a clear sticky film that coats your teeth. It's due to eating a lot of sugars and starches and not cleaning your tooth well. When sugars and starches are not cleaned off your teeth, bacteria quickly begin feeding on them and form plaque. Plaque that stays on your teeth can harden under or above your gum line into tartar or calculus. Tartar makes plaque more difficult to remove and creates a shield for bacteria. So that is the first cause of cavities, plaque forms. Now let us go to the second cause of cavities, which is called the plaque attacks. These are acids. The acids in plaque remove minerals in your tooth, in your tooth's hard outer enamel. Remember that outer part of the teeth we said is the enamel. So these acids in plaque remove minerals in your tooth's hard outer enamel. So this erosion causes tiny openings or holes in the enamel. The first stage of cavities is this. Once areas of enamel are worn away, the bacteria and acid can reach the next layer of your teeth, called the dentine. This layer is softer than enamel and less resistant to acids. Dentine has tiny tubes that directly communicate with the nerve of the tooth, causing sensitivity. So most of the times when you feel that sensitivity, you get to know that this is the attack that your tooth is facing. The sensitivities whenever you eat cold or warm, when the tooth is actually sensitive, it is due to the plaque attacks. The third cause of cavities is what we call destruction. So when destruction continues, so as tooth decay develops, the bacteria and acid continue their march through your teeth, moving next to the inner tooth material, which is the pulp, that contains nerves and blood vessels. The pulp becomes swollen and irritated from the bacteria. Because there is no place for the swelling to expand inside the tooth, the nerve becomes pressed, causing pain. Discomfort can even extend outside to the tooth root to the bone. So basically those are the three major causes of cavities. We've looked at the plaque forms, we've looked at the plaque attacks, and we've looked at after the plaque have attacked your tooth, the third stage is the destruction of the tooth. That is, the destruction continues, and then hence leading to the tooth decay. Now for all those that are viewing, please consider subscribing, sharing, liking, and commenting. Let us go straight to the risk factors associated with cavities. So when you talk about the risk factors, this is what we mean. Everyone who has teeth is at risk of getting cavities, but the following factors can increase the risk. Number 1, tooth location. Decay most often occurs in your back teeth, that is, the molars and premolars. These teeth have lots of grooves, pits and crannies, and multiple roots that can collect food particles. As a result, they are harder to keep clean and your smoother, easy to reach front teeth. So basically, the tooth location is one risk that stimulates the tooth decay. The second risk factor is talking about certain foods and drinks. Foods that cling to your teeth for a long time, such as milk, ice cream, honey, sugar, soda, dried fruit, cake, cookies, hard candy, and mints, dry cereal, and chips are more likely to cause decay than foods that are easily washed away by saliva. Looking at the third risk, frequent snacking or sipping. When you steadily snack or sip sugary drinks, you give mouth bacteria more fuel to produce acids that attack your teeth and wear them down. And sipping soda or other acidic drinks throughout the day helps create a continual acid bath over your teeth. So the frequent sipping and snacking increases the risk of your tooth to cavities. Looking at another risk is what we call bedtime infant feeding. Bedtime infant feeding. When you talk about the bedtime infant feeding, this is what we mean. So when babies are given bedtime bottles filled with milk, formula, juice, or other sugar-containing liquids, these beverages remain on their teeth for hours while they sleep, feeding decay, causing bacteria. This damage is often called baby bottle tooth decay. Similar damage can occur when toddlers wander around drinking from a sippy cup filled with these beverages. Looking at the next risk factor is inadequate brushing. If you don't clean your teeth soon after eating and drinking, plaque forms quickly and the first stages of decay can begin. Let us look at the next risk factor, number 6, not getting enough fluoride. Fluoride, a naturally occurring mineral, helps prevent cavities and can even reverse the earliest stages of tooth decay. Because of its benefits for teeth, fluoride is added to many public water supplies. It's also a common ingredient in toothpaste and mouth rinses, but bottled or packed water usually does not contain fluoride. Looking at the next risk factor is the younger or old age. In most cases, cavities are common in very young children and teenagers. Older adults also are at high risk. Over time, teeth can wear down and gums may recede, making teeth more vulnerable to root decay. Older adults also may use more medications than reduce saliva flow, increasing the risk of tooth decay. Looking at the next risk factor is what we call the dry mouth. Dry mouth is caused by lack of saliva, which helps prevent tooth decay by washing away food and plaque from your teeth. Substances found in saliva also help counter the acid produced by bacteria. Certain medications, some medical conditions, radiation to your head or neck, or certain chemotherapy drugs can increase your risk of cavities by reducing saliva production. Number 9. Worn fillings or dental devices. Over years, dental fillings can weaken, begin to break down, or develop rough edges. This allows plaque to build up more easily and makes it harder to remove. Dental devices can stop filling well. can stop fitting well, allowing decay to begin underneath them. Number 10. Heartburn. Heartburn, or what we call the gastroesophageal reflux disease, can cause stomach acid to flow into your mouth, which is the reflux, wearing away the enamel of your teeth and causing significant tooth decay. This exposes more of the dentin into attack by bacteria, creating tooth decay. Your dentist may recommend that you consult your doctor to see if gastric reflux is the cause of enamel loss. Looking at the next risk factor is what we call the eating disorders. Here we mean anoxia and bulimia can lead to significant tooth erosion and cavities. Stomach acid from repeated vomiting or purging washes over the teeth and begins dissolving the enamel. Eating disorders also can interfere with saliva production. Thank you for all those that are viewing. Please endeavor to subscribe, share, like, and comment. In the next video, we are going to still continue with the study of the teeth, and we shall be in position to get to know the solutions, what can be done to prevent the cavities, what can be done to prevent the tooth decay. So in the next video, be expectant to receive that. Brand Black 2 TV. Please subscribe, share, like, and comment. Thank you.